We recommend the procedure in this video for urine sampling with culture and for emergency evacuation of the bladder. There are contraindications when doing a cystocentesis. Use caution with thrombocytopenia, bleeding, or clotting disorders the patient might have. Only trained personnel should perform a cystocentesis. The procedure carries risks. When gathering supplies, make sure you have everything available: 12 cc syringes, 22 gauge 1.5-inch needles, 22 gauge 1-inch needles, 20 gauge 1-inch needles, small red top tubes or whatever you put your urine sample in, isopropyl alcohol soaked cotton balls, isopropyl alcohol squirt bottle, and dry 4x4s. Make sure the syringes are at the ready for the person doing the procedure. Unwrap the syringe and ensure that the plunger functions. Apply that first 22 gauge 1.5-inch needle to the top of the syringe. Ensure that the cap is nice and loose so you can remove it with ease before the procedure. One restraint technique for cystocentesis is lateral recumbency. Staff members gently pick the patient up and lay it on the table. It's easier for the person doing the procedure. Make sure to provide distractions for a patient in this position. You may need 2 restrainers for larger breed dogs. One person's on the back end, supporting the rear legs. The other is on the front, distracting the patient. Relax the back legs if they're too tense. This enables the person doing the procedure to palpate the bladder easily. Palpate the bladder with your hand to feel and stabilize it. Then swab the area with alcohol, where the needle will draw the sample. Remove the cap from the needle. The non-dominant hand holds the bladder. The dominant hand injects the needle into the bladder and removes the sample slowly. If you see blood in the syringe or the hub of the needle, stop immediately and get a new syringe and needle. If you can, obtain 12 ml of urine when performing a cystocentesis. Remove the syringe when your sample is complete. Cap the needle carefully when done to avoid contamination of the sample and to ensure the staff does not get injured by the needle being exposed. Let the patient up and reward them for good behavior. Then add the sample to the sterile sample tube. This is sent out or held to run in-house. Place all urine in a collection device, and always label it with the patient's info. Another position for restraint is dorsal recumbency. This position means the patient lies on their back. Again, with a larger breed dog, you may need 2 people holding the patient, one on the back, one on the front. The patient is usually most comfortable in a trough. Use the squirt bottle to apply alcohol to the area. The bladder usually lies beneath where the alcohol pools. Wipe off any excess. When performing a cystocentesis without ultrasound, make sure to palpate the bladder before obtaining your sample. You'll want to ensure that the bladder is big enough. Note that the male dogs are different. You insert the needle on the side of the penis. This patient is female, so inject the needle where the alcohol pools on the abdomen. Apply small pressure with the needle to insert. Obtain the sample just as you did when the patient was in lateral recumbency. If possible, pull up 12 ml of urine. If there's blood in the syringe or the patient squirms, remove the needle right away. If the syringe is clear, once you get the sample, remove the needle. Time to reward the patient. And now, change out our used needle for a new sterile one. Put the urine in a sample tube. This is where a 20 gauge needle comes in handy. Let the vacutainer remove the sample amount required to fill the tube. Put extra sample urine in tubes for reserve. And don't forget to label. Now that you've diagnosed your furry friend's problem, time to treat it and bring back the happy.